Today, we're tackling a critical question. A prednisone warrior asked, "What can I do to help while on prednisone for bone loss?" Prednisone is a powerful anti inflammatory medication that saved my life and many other people. But it comes with a critical side effect that most people don't appreciate until it's too late, and that's bone loss. It's also known as glucocorticoid-induced osteoporosis, or GIOP. This can increase your risk for fractures, broken bones, hip breaking, and loss of height from the spinal bones compressing on each other. But don't worry, there are things you can do to help protect your bones and minimize bone loss while taking prednisone. I'm going to share the latest research, things that are just emerging to help you know what to do to protect your bones while on prednisone. First, we need to understand why prednisone is causing bone loss. Prednisone is mimicking our body's naturally occurring hormone called cortisol. Cortisol is designed by Mother Nature to help us survive disaster times, and it's prioritizing short-term survival instead of long-term health. And so it's taking nutrients and density and all of your long-term savings from your bones, muscles, and liver and making it so that you're spending all that savings account and you're losing bone mass. And these are the ways prednisone specifically is doing that. First, prednisone is reducing bone formation. So the builder cells in the bones, called osteoblasts, have less activity while on prednisone. So we're not building up, and so that's lower bone formation while on prednisone. The second thing that is potentially worse is prednisone is increasing the activity of the bone cells that break down bone. These are called osteoclasts. One study showed that even one dose of prednisone starts your body on this path of less bone formation and more bone breaking down. So the doctors who prescribe prednisone the most are really concerned about this because they're basically giving you this poison pill for whatever inflammatory or autoimmune condition you have. And then it's causing you irreparable harm. Like there's nothing you can do once you've broken that bone. It's broken. The bone loss is permanent and irreversible. But so how can we prevent it from happening or minimize the damage once it has already started happening? They have a guideline they created called the American College of Rheumatology Glucocorticoid-Induced Osteoporosis Guideline. And in it, they recommend several lifestyle things. First is to eat a healthy diet so that you minimize weight gain. Second, to quit smoking. And third, to minimize alcohol intake because both smoking and alcohol can worsen bone strength. Finally, they recommend weight-bearing exercise, things that can impact your bones because that helps trigger more bone formation. Things like walking, dancing, running, and weightlifting to support your bones so that you don't fall and break a hip, so that your muscles of your core are strong enough so that you don't fall. They also recommend supplementation. So prednisone is depleting calcium and vitamin D in the bone. And so we want to give that back. Calcium is the building block of bone. So they recommend 1,000 to 1,500 units of calcium per person per day, depending on the type of health situation you're in. If you're a postmenopausal female, if you've been on prednisone a long time, if you're low body weight, things like that, you'd want to optimize for a higher dose of calcium. But definitely, if you have any questions about it, reach out to your doctor. And optimize your dietary intake of calcium in general, such as leafy greens, dairy, and other fortified foods. Next is vitamin D. So this is the sunshine vitamin, and we want to optimize our sunlight time, exposure to the sun, so that you get the naturally occurring way of making vitamin D, which is exposing skin to sunlight. So you can convert it into vitamin D. But sometimes it's not the right time of year where you can do that, or you might have a skin type or a disease where it's not safe. So they recommend supplementing enough vitamin D so that you can get into the normal range of vitamin D on a blood test. So you can get that blood test. You can order it on my website, or you can ask your doctor to order a blood test for vitamin D. It's a 25 hydroxy vitamin D test. And that way you can know for sure that you have enough vitamin D to help the calcium be absorbed from your gut and to be used properly for your bones. Magnesium is another supplement that you're going to need, and it helps activate the calcium properly, helps the vitamin D in its job of making your body use the calcium. And a dose of 200 to 400 milligrams of magnesium, my favorite kind is magnesium glycinate per day, is the amount you could go up to. Next, you want to make sure that the calcium is not going to your arteries and causing hardening of the arteries, which increases your risk for heart disease complications. Since prednisone is already causing an increased risk for heart disease, we want to do what we can to minimize that side effect while we're optimizing for the bone side effect, right? So you need vitamin K2 in order to tell the calcium to avoid the arteries and go to the bone. You need somewhere between 90 and 120 micrograms of vitamin K2 per day. And my favorite kind of vitamin K2 is menaquinone 7. Next, a really interesting article recently was released measuring something nobody has talked about before that I am aware of as something that can help with bones, and that's chromium. Chromium is a metal mineral that I like to talk about because it helps with blood sugars while on prednisone. But I want to quote this. A recent study published in Molecules found that chromium picolinate may regulate bone metabolism and reduce bone loss in diabetic osteoporosis models. That's cool. And so a dose of 200 to 400 micrograms per day is what they used in the study. Though more research is definitely needed to support routine recommendations, but I find that amazing because now chromium picolinate can help reverse diabetes and improve bones from osteoporosis. That's pretty awesome. In addition to those lifestyle habits, supplementation, often people will need prescription medication to support your bones to prevent fractures and having to get a hip replacement. So this is what that guideline recommends. First are bisphosphonates, things like Fosamax, alendronate. They slow the bone breakdown, and they're often the first line choice for preventing fractures. Essentially what they do is freeze your bones as they are at this moment. It's just, okay, ready, stop, right where you are. They don't necessarily build up bone themselves, but they are stopping the bone loss. The next is denosumab, which is brand name Prolia. This is an injectable medication that reduces bone resorption, and it's an option for those who can't take bisphosphonates like Fosamax. Next is Forteo, or teriparatide. This type of medication is for severe bone loss, and it helps stimulate new bone formation. And your doctor can assess your risk for bone loss using tools like FRAX, F-R-A-X. It's a tool to help decide how likely you are to break a bone, and so how drastic of measures you need to take. Another emerging research showed this new development, and I'm just going to read it straight because these are big words. 11-beta HSD1 inhibitors. A study in PMC highlighted the potential of 11-beta HSD1 inhibitors to prevent glucocorticoid-induced bone loss by targeting how prednisone is metabolized in bone tissue. That's cool. It's not widely available yet, but essentially what they're doing is attaching something to prednisone so it can't go to the bone. Interesting. I hope they keep doing research to find ways to minimize side effects. That's always my goal, is to share all the ways to help you feel as well as possible while taking prednisone. As the prednisone pharmacist, I'm here to help you not just survive prednisone, but thrive while on prednisone. And so to summarize some of the tips I've shared here, optimize your lifestyle, quit smoking, quit drinking, exercise, eat a good diet, supplement with calcium, vitamin D, magnesium, vitamin K2, and chromium picolinate. And if needed, you can start medications to prevent bone loss. What's awesome is that all of those supplements I just mentioned are present in Nutranize Zone. I invented it to help people on prednisone from my personal experiencing terrible prednisone side effects. And I created a morning bottle with 2 in the morning and bedtime bottle with 2 at bedtime. And you take that and it's got the calcium, vitamin D, vitamin K2, magnesium, and chromium picolinate in the exact dose of that study. So you can take this and you'll know that you're doing what you can to minimize bone loss because you're replenishing the nutrients recommended in that guideline and with that emerging research. Do those lifestyle things as well and talk to your doctor if you need to. But this is the baseline first step to help you feel like yourself again while taking prednisone. Thousands of people have taken it while taking prednisone to help minimize those side effects. In addition, it can help with minimizing other side effects, such as what it's doing to your metabolism, your mood, your energy, and your sleep. That's why I've got a bedtime bottle to help you get restful sleep at night. So you can just go to nutranize.com to get it today, or it's also available on Amazon. Signing off is Dr. Megan, your prednisone pharmacist.